Before we begin, make sure you're subscribed to the channel and turn on notifications, because what you're about to hear could literally protect your life. What if I told you that your kidneys could be slowly shutting down, and you wouldn't feel a single thing? No pain, no clear warning, no dramatic signal, just silence. Your kidneys work 24 hours a day, filtering your blood, removing toxins, balancing fluids, activating vitamin D, producing hormones that help you make blood, and keeping you alive. Without them, survival is impossible. That's not an exaggeration. That's biological fact. But here's the terrifying part. Most people only discover kidney failure when more than 70 or 80% of their function is already gone. So today, we're going to answer 3 critical questions. Why do kidneys stop working? Does it hurt when it happens? And most importantly, how can you prevent it before dialysis becomes your only option? Stay with me until the end, because the most important part is prevention. When kidney failure begins, it rarely announces itself with drama. In the early stages, most people feel completely normal. That's because your kidneys are incredibly resilient. Even if one loses function, the other compensates. Even when both are struggling, your body adapts quietly. But beneath that silence, damage may already be happening. Chronic kidney disease usually develops slowly over months or years. The most common causes are uncontrolled diabetes and high blood pressure. These 2 conditions slowly damage the tiny blood vessels inside the kidneys, reducing their ability to filter waste. There are also other triggers: repeated infections, autoimmune diseases, long-term use of certain medications, severe dehydration, genetic disorders, and even untreated kidney stones. In acute kidney failure, things can happen faster, sometimes within days. Severe infections, major blood loss, heart failure, or toxic drug reactions can suddenly interrupt blood flow to the kidneys. But here's the key truth. In both cases, pain is not guaranteed. Many people assume that organ failure must be extremely painful. With kidneys, that's not always true. And that's what makes it dangerous. Because when symptoms finally appear, the damage may already be advanced. Here's the question most people are afraid to ask. Does kidney failure hurt? The honest answer, not at first. Kidney failure itself is often painless in the early and even middle stages. The kidneys don't have pain receptors that trigger obvious discomfort when their filtering function declines. So the gradual loss of function can happen silently. However, certain conditions associated with kidney problems can cause pain. For example, kidney stones can produce intense, sharp pain in the lower back or side. Infections may bring fever and discomfort. Swelling from fluid retention can cause pressure and heaviness. But the failure process itself? It's often quiet. As toxins begin to accumulate in the bloodstream, the symptoms tend to be subtle at first. Fatigue that doesn't improve with rest, mild swelling in the ankles, changes in urination, difficulty concentrating, nausea, or a metallic taste in the mouth. These are easy to ignore, easy to blame on stress, easy to postpone. And that's how people lose precious time. By the time shortness of breath, confusion, severe swelling, or chest pressure appear, kidney function may already be critically low. The absence of pain does not mean the absence of danger. Now let's talk about what truly matters, the warning signs. These symptoms may seem small, ordinary, easy to dismiss, but together, they can signal that your kidneys are struggling. Sign 1. Persistent fatigue. If you feel exhausted even after a full night of sleep, it may not just be stress. Damaged kidneys produce less erythropoietin, a hormone that helps create red blood cells. Fewer red blood cells mean less oxygen circulating through your body, and that leads to constant tiredness. Sign 2. Swelling in the legs, ankles, or face. When kidneys can't remove excess fluid properly, it accumulates. You may notice tight shoes, puffy eyes in the morning, or swelling that doesn't go away. Sign 3. Changes in urination: foamy urine, darker color, urinating more at night, or producing much less urine than usual. All of these can signal filtration problems. Sign 4. Shortness of breath: fluid can build up in the lungs, or anemia may limit oxygen delivery, making even small efforts feel exhausting. Sign 5. Nausea or loss of appetite: as toxins accumulate in the bloodstream, they affect digestion. Food may lose its appeal. A metallic taste may appear. Individually, these signs may seem harmless. Together, they demand attention. The most powerful word in medicine is not treatment. It's prevention. Kidney failure rarely happens overnight. In most cases, it is the final chapter of years of silent damage. And that means something extraordinary. You have time to act. Control your blood pressure. Monitor your blood sugar. Drink enough water, but don't overdo it. Avoid long-term use of medications without medical supervision. Reduce excessive salt. Move your body. Get regular blood and urine tests, especially if you have diabetes, hypertension, or a family history of kidney disease. A simple creatinine test. A basic urine analysis. These small checkups can reveal what your body is whispering before it starts screaming. Your kidneys ask for very little, but they give you everything: balance, filtration, survival. So let me ask you something deeply personal. If your body has been sending you quiet signals, have you been listening? If this message helped you see your health differently, share your thoughts in the comments. And if you're not subscribed yet, this is your moment. Subscribe now, because protecting your future starts with awareness today.